Hello everyone and welcome back to the channel. If you recently had a blood test and your doctor has told you that your anti-CCP antibody is positive, you're probably feeling worried. Perhaps your GP mentioned rheumatoid arthritis, or maybe you did what most of us would do. You typed positive CCP antibody into Google. Within a few minutes, you've read about autoimmune disease, lifelong medication, and permanent joint damage, and it's completely understandable if your mind has started racing. One of the commonest things I hear in my clinic is, "Doctor, my CCP antibody is positive. Does that mean I've definitely got rheumatoid arthritis?" My answer is always the same. It certainly makes rheumatoid arthritis more likely, but it absolutely does not confirm the diagnosis on its own. That's really the key message I'd like you to take away from today's video. The anti-CCP antibody is one of the most useful blood tests we have in rheumatology, but like every investigation in medicine, it only makes sense when you interpret it alongside your symptoms, your examination, and sometimes even scans. Today, I'd like to explain exactly what this blood test is, why rheumatologists rely on it so much, how accurate it really is, what it tells us about your future risk of developing rheumatoid arthritis, and perhaps most importantly, what it doesn't tell us. By the end of this video, you'll understand why a positive anti-CCP result isn't something to ignore, but equally, it isn't something to panic about either. Let's begin with the name itself because I know it sounds incredibly scientific. Anti-CCP stands for anti-cyclic citrullonated peptide antibody. Thankfully, nobody expects patients to remember that, so virtually everyone, including doctors, simply calls it anti-CCP or CCP antibody. To understand why it's important, we first need to think about how the immune system normally works. Every second of every day, your immune system is protecting you against bacteria, viruses, and other infections. It's constantly recognizing things that don't belong in your body and eliminating them before you even realize they're there. Autoimmune diseases develop when that incredibly sophisticated system becomes confused. Instead of recognizing harmful invaders, it mistakenly identifies parts of your own body as foreign and starts attacking them. In rheumatoid arthritis, one of the abnormalities we see is the production of antibodies against proteins that have undergone a normal chemical change called citrullination. You don't need to remember that word because nobody's going to test you on it, but it's these antibodies that we're measuring when we request an anti-CCP blood test. Now, here's what makes anti-CCP so remarkable. Unlike many blood tests, it can become positive years before somebody develops rheumatoid arthritis. Imagine that for a moment. The immune system may already be changing quietly in the background while the joints still feel perfectly normal. In some people, these antibodies are detectable several years before they ever notice swollen fingers or painful wrists. It's a little like seeing dark clouds gathering long before the rain starts falling. The immune system is beginning to change, but the disease hasn't fully declared itself yet. That's one of the reasons rheumatologists value this test so highly. It doesn't just tell us about what's happening today. Sometimes it gives us a glimpse of what may happen in the future. This is also where a lot of unnecessary anxiety begins because people hear that anti-CCP predicts rheumatoid arthritis and immediately assume they must have the disease. I completely understand why people think that, but medicine is rarely that simple. A blood test on its own never makes a diagnosis. Every week I see patients who arrive convinced they have rheumatoid arthritis because they've seen a positive result on the NHS app before they've even spoken to their GP. The first thing I usually tell them is that we never diagnose people from one blood test. We diagnose people by putting lots of pieces together. We listen to your story. We ask when the pain started. We ask whether your joints are swollen. We ask whether you're stiff first thing in the morning. And if you are, how long that stiffness lasts. We examine every joint carefully. We look at inflammatory markers, x-rays, ultrasound scans, and MRI scans if they're needed. Only after we've gathered all of that information do we decide whether someone has rheumatoid arthritis. The blood test is incredibly helpful, but it's only one piece of the puzzle. Imagine two patients coming into my clinic on the same morning. The first patient tells me their fingers have been swollen for 3 months. They struggle to remove their rings in the morning because their knuckles are puffy. Their wrists ache every day. Morning stiffness lasts well over an hour, and blood tests show raised inflammatory markers together with a strongly positive anti-CCP antibody. Now imagine the second patient. They feel completely well. They had some routine blood tests because of unrelated problem, and quite unexpectedly, the anti-CCP antibody came back positive. They've never had swollen joints. They don't wake up stiff. They're active. they exercise, and all of their inflammatory markers are normal. Although both patients technically have a positive anti-CCP result, they're in completely different situations. The first patient is very likely to have rheumatoid arthritis. The second patient may never develop it. That's why rheumatologists spend much more time talking to patients than looking at blood results. Context is everything. Another question I hear all the time is, what's the difference between anti-CCP and rheumatoid factor? Blood tests are commonly requested together, and they complement each other very well, but they aren't the same thing. Rheumatoid factor has been around for decades and was the main blood test we used before anti-CCP became widely available. It's still useful today, but it has one important limitation. It isn't particularly specific. Rheumatoid factor can be positive in healthy older adults, in people with chronic infections, in Sjogren's syndrome, and in several other autoimmune conditions. Occasionally, it's positive in people who never develop arthritis at all. Anti-CCP is different. It's far more specific for rheumatoid arthritis, which means that when somebody has the typical symptoms together with a strongly positive anti-CCP antibody, it gives us much greater confidence that rheumatoid arthritis is the correct diagnosis. If I had to choose just one blood test when I suspect rheumatoid arthritis, it would almost always be anti-CCP because it's the test that tells me the most. One of the fascinating things we've learned over the past 20 years is that rheumatoid arthritis doesn't suddenly appear overnight. For many people, there's a silent phase where the immune system has already become abnormal, but there are no obvious symptoms. Researchers sometimes call this the preclinical phase of rheumatoid arthritis. Anti-CCP antibodies may already be circulating in the bloodstream while the patient feels perfectly healthy. That's important because we know that the earlier rheumatoid arthritis is diagnosed, the better the long-term outcome. You may have heard rheumatologists talk about the window of opportunity. This refers to the first few months after inflammatory arthritis develops, when treatment is most effective. Starting medication early can reduce long-term joint damage, improve function, and even increase the likelihood of achieving remission. That's why we don't like patients waiting 6 months or a year before they're assessed. If you develop persistent swelling in your joints, particularly in the hands or feet, together with prolonged morning stiffness, it's worth seeing your GP promptly because early referral to a rheumatologist really can make a huge difference. Patients often ask me whether the actual anti-CCP level matters. Generally speaking, yes, high levels tend to be associated with a greater likelihood of rheumatoid arthritis and in some studies with a greater risk of more severe disease. However, I always tell patients not to become obsessed with the number itself. Medicine isn't quite as simple as saying a level of 50 is good and a level of 300 is bad. I've looked after patients with very high anti-CCP antibodies who have done brilliantly for years because their disease was diagnosed early and treated effectively. Equally, I've seen patients with relatively modest antibody levels who required treatment because they had active inflammatory arthritis. It's always the whole clinical picture that guides our decisions rather than a single laboratory value. Another common concern is whether a positive anti-CCP means you should start treatment immediately. In most cases, the answer is no. We don't treat blood tests, we treat disease. If someone has a positive antibody but no evidence of inflammatory arthritis, we'll usually monitor them carefully rather than prescribing medication straight away. On the other hand, if somebody has swollen joints, prolonged morning stiffness, and ultrasound evidence of active inflammation, then starting treatment early becomes incredibly important because we know that controlling inflammation quickly leads to much better long-term outcomes. Before we finish, I also want to mention something that many people don't realize. Not everyone with rheumatoid arthritis has a positive anti-CCP antibody. Around 1 in 4 patients have what's called seronegative rheumatoid arthritis, meaning both rheumatoid factor and anti-CCP are negative. They still have rheumatoid arthritis because the diagnosis is based on the pattern of symptoms, examination findings, and imaging, not simply on blood tests. Equally, not everyone with a positive anti-CCP antibody will develop rheumatoid arthritis. That's why it's so important not to jump to conclusions based on one result alone. So if you've recently been told your anti-CCP antibody is positive, what should you do? First of all, don't panic. Secondly, don't rely on internet forums to diagnose yourself. Arrange an assessment with your GP or a rheumatologist, particularly if you've developed swollen joints, prolonged morning stiffness, or persistent pain in your hands or feet. Sometimes we'll simply reassure you. Sometimes we'll arrange an ultrasound scan to look for early inflammation. Sometimes we'll decide that no treatment is needed but continue to monitor you. And if rheumatoid arthritis is developing, we'll start treatment early to give you the best possible chance of protecting your joints for the future. The key message I'd like you to remember from today's video is this. Anti-CCP is one of the most valuable blood tests we have in rheumatology, but it's never the whole story. A positive result makes rheumatoid arthritis more likely, but it doesn't make the diagnosis on its own. Good rheumatology is about putting all the pieces together and understanding the person sitting in front of you, not simply treating a laboratory result. If you found this video helpful, please give it a like and consider subscribing to the channel. I regularly produce videos explaining rheumatology conditions, blood tests, and treatments in a way that's hopefully easy to understand. And if you'd like to see me for a consultation, you can find details of Pure Rheumatology London in the description below. Thank you very much for watching, and I'll see you in the next video.